A tax bill that changes Medicaid is now over a key hurdle.
That's right. The House Budget Committee passed it late yesterday. It includes cuts to Medicaid funding. And joining us now is Dr. Afif El-Hasan, the board chair of the Public Policy Committee for the American Lung Association, to talk about these cuts. Thank you so much for being with us this morning.
Thank you.
Yeah, this is drastic cuts to Medicaid. We're talking about insurance that covers about 80 million people. They want to make about $800 billion in cuts over 10 years, we should say. Talk about the impact you foresee of these cuts.
There's going to be multiple impacts, not only to the patient themselves, but to all of us. So for the patients, if anyone loses coverage, they'll be unable to manage their chronic illnesses, unable to deal with getting access to health care, so they'll end up more in the emergency room, and their chronic conditions will get worse because it's untreated, and they won't have access to preventative care. So screenings for cancer, vaccinations will not be accessible to them.
Wow. And Doctor, last week Governor Newsom called for cuts to Medi-Cal, and you actually treat children who benefit from this program.
Yes.
Can you explain to us what this could mean for your patients and in general for healthcare in the state of California?
Absolutely. The best way to stage this would be with an example. So let's take an asthmatic child who's been treated with their asthma very well. They're on preventative medication, and let's take away their insurance. Now you're going to be dealing with a child who's no longer able to manage the asthma, is going to go into the emergency room more to get their care, the parents are going to actually have to leave work more to take care of the child, and all of this would have been preventable. All of it would have been preventable.
Okay, let's talk about one of the more controversial points that was being discussed yesterday before it passed. This latest hurdle is the employment requirements. Why is that so controversial, and how do you feel about that part? Some would say it's fair that people have to work to have insurance.
Already nationally, 92% of people who have Medicaid, which is called Medi-Cal here in California, already either work or are students, are caregivers, or are too ill to work. So what will end up happening is you'll set up a wall of red tape for those people to get the care to prove that they're working or otherwise are eligible. So it's a lot of red tape, a lot of barriers for a group of people who the vast majority are already fitting the criteria of needing the Medicaid and shouldn't have to go through more red tape to get access to health care.
Absolutely, Doctor. I'm sure you know most, if not all, people are concerned about the financial aspect of all this, right? Can you explain to us how these cuts can potentially increase healthcare costs for all of us?
Absolutely, and it will increase healthcare costs for all of us. If you diagnose and treat diabetes early, that person is going to stay healthy. They're going to stay in the workforce. They're not going to end up on dialysis for kidney problems. They're not going to get an amputation. But if you take away that care, we have to treat the significant progression of the disease. And that doesn't just affect the patient, it affects all of us because it increases expenditure in this country. And that person who is otherwise going to be a working person who takes care of their family and takes care of themselves would possibly become unemployed or less likely to be employed. And that obviously has implications as well.
Absolutely.
Highlights the importance of preventative care.
Yeah, these cuts will impact millions of people, and as you say, potentially could stop them from getting that preventative care. So we'll continue to follow what happens with this bill. Thank you so much for being with us, Dr. El-Hasan.
Thank you very much.
Appreciate your thoughts.